Welcome to today's webinar, DICRA Data Reporting by SACs, Initial Challenges and Solutions. Again, my name is Mark Myrant, and I'm a research associate with the Justice Research and Statistics Association, and I'll be serving as the moderator today. This webinar is supported by funding from the Bureau of Justice Statistics, Office of Justice Programs, U.S. Department of Justice. Now, in 2019, federal enforcement of the Death in Custody Reporting Act, DICRA, was transitioned to the Bureau of Justice Assistance, and responsibility for state-level data collection was given to the State Administering Agencies, what we call the SAAs. In many states, the required data collection and reporting tasks have been assigned to State Statistical Analysis Center, the SACs, beginning with the October through December 2019 reporting period. As you may know, JRSA President Jim McDonough sent out a short survey a couple weeks ago to SAC directors asking about their involvement with DICRA. And quickly, we heard back from 19 states, and of those, 12 indicated that they were responsible for reporting the DICRA data for their state. I suspect total nationally is probably higher. 11 of those 12 reported that they had a set process for reporting it to BJA, and all 12 had submitted data for that first quarter of October through December of 2019. This webinar will provide insights on how several SACs are conducting this work, the methods they're using, the challenges they've encountered thus far, and how those challenges have been met. The webinar is intended to provide assistance to SACs, but also to other state officials who may be tasked with DICRA enforcement, so that they may still be, in case they're still working on finalizing or refining implementation. And with that, I'd like to welcome today's presenters. Taylor Gann is a research analyst with the Georgia Criminal Justice Coordinating Council. Marjorie Stanek is director of the Kentucky Statistical Analysis Center. Lisa Schoaf is the director of the Ohio Statistical Analysis Center. And Jim McDonough, again, is JRSA president, and he is director of the Virginia Statistical Analysis Center. I will now turn it over to Taylor Gann.
Do I have permission to, since I'm not the prisoner? There we go. Oh, thank you. All right, so good afternoon, everyone. As Mark was kind enough to introduce me, my name is Taylor Gann, and I'm a research analyst with the Georgia SAC that is situated in the Criminal Justice Coordinating Council. As the others, as well as myself, are here today to talk to you about some of the challenges the Georgia SAC has encountered during our data collection efforts and some of the solutions we have developed to combat some of these issues. Although we experienced a few bumps in the road, although minor throughout this process, the major challenges we faced were identifying reportable agencies and how to contact them, developing a data collection tool while also devising a plan to disperse the tool, and confirming non-reporting from Georgia counties and how that may have affected our overall data quality. As you are going to hear from some of the other presenters, I'm sure, figuring out who qualified as a reporting agency was the first initial step for our data collection efforts. So given that in Georgia we have roughly 670 law enforcement offices across the state, and many of which we don't at the SAC have personal working relationships with, this initially seemed like a really daunting task at the beginning. So to address this contact issue, and given the number of reporting agencies, we use Georgia law in order to help identify reportable facilities that were already collecting this information. So according to the Georgia Death Investigation Act, all law enforcement agencies and correctional institutions must report an in-custody death to their county's respective medical examiner. In Georgia, there are 5 metropolitan medical examiner offices that oversee this collection for all of the counties in their respective areas. This includes Gwinnett, Fulton, DeKalb, Cobb, and Clayton County. I do want to note here that Clayton County is overseen by GBI, which is important because the Georgia Bureau of Investigation also oversees other inquiries across the state that are not included in these counties. So along with these 5 metropolitan medical examiner offices and the GBI, we also identify Georgia Department of Corrections and the Department of Juvenile Justice as potential reporting agencies to examine any deaths that are already occurring in custody while inmates are incarcerated, or for any juveniles that are already in custody through that system. So once we identified the previously mentioned agencies, we reached out to both the Georgia Bureau of Investigation and the Georgia Department of Corrections to get kind of a lay of the land and to contact and get contact information for other MEOs. So although getting the GDC and GBI on board was relatively straightforward, making contact with the other 5 offices was a bit more challenging. Over the course of several months, we made frequent contact to these offices, but only a couple were initially responsive. Brings us to another major challenge when engaging these agencies was solidifying these relationships and garnering these appropriate contacts. So we had to reach out to GBI several times in order to find new contact if the old contact we had asked didn't report back. And ultimately, we were able to make contact with all of the medical examiner offices and participating state agencies. So during this time, while we're still trying to figure out these relationships, we were also in the process of attending DICRA webinars to help devise best practices for data collection and how our data collection tool would ultimately look. Since we were given a lot of creative freedom for tool development, we reached out to the Georgia Department of Corrections to see how they collected their data. We used their Scribe system, kind of like the interface they use there to input data, given that they collect so much extensive information on inmates. And through our combined efforts, we were able to create the tool that's shown here. GDC also helped us create a tool report that we sent out to reporting agencies to give them an idea of how to fill out the reports and what each field would really look like. So once we drafted a collection tool, we worked with our IT department to set up a secure server to store the data. This data is stored on our Azure Government SharePoint, and each individual has access to their respective data, and they don't have permissions to view other people's data, so you can't look at other agencies' information. So once we established a secure data sharing method, we dispersed the tool, the test report, and had several training sessions to discuss what applicable deaths look like. These sessions included extensive talks on definitions, sorting through coroner reports to provide concrete examples, and just going over possible case-by-case scenarios to kind of give these agencies an idea of what information we were looking for. So the major challenge here was not only contacting these agencies and developing a tool, but to facilitate reporting on a monthly basis, because initially we wanted agencies to send us these reports so we could compile all of the data before the reporting period and to sort through any deaths that may not be applicable due to the current guidelines. We still have issues with this today. We send out monthly reminders for data requests, but given that these agencies are not required to report to us specifically, we still are experiencing some issues with that, but we're still trying to work toward, we still get the reports every month, or not every month, but every period, but the monthly has been kind of an issue. This leads me to our last and I think major concern is after establishing a process for data collection, we then were faced with the issue of confirming non-reporting. Since January 1st, 2020, roughly 17% of all Georgia counties have reported a death in custody to their respective medical examiner. This leaves about 83% of Georgia counties that are classified as non-reporters. Although the Investigations Act previously mentioned mandates that agencies report these deaths, we do not have a method currently in place to 100% confirm this. To combat this issue, we're in the process of pursuing a memorandum of understanding with our Department of Public Health to gain access to death certificate information. The rationale here would be to compare our numbers with the number of death certificates and also to confirm the manner of death in these cases. However, the problem here is we're experiencing serious delays in this request due to a backlog at the DPH. So since we figured we would not be securing an MOU at this time, we also considered developing a reporting survey by employing our current ISA system that we use for other data collections. This system, we're able to develop survey instruments and disperse them through survey links to any participants for that particular survey. However, the same problem that we had before with identification, we do not currently have the resources to pursue this avenue because we don't have the relationships in place or the contact information to send out the survey links. So as we're still evolving in this, trying to combat this issue, these are some of the things that we've thought of prior to today. So this brings me to, I think, the biggest concern is data quality. So given that we cannot fully confirm non-reporting, we may be missing a few deaths in some of the more secluded counties or just counties that we're not getting that information from. Another big issue with regard to data quality are that given the current guidelines, only some deaths are deemed appropriate for reporting. By this I mean that some deaths that are pronounced, when a death is pronounced at a hospital, that is considered non-reportable. However, with regard to the current pandemic and COVID cases, I feel that we are missing some of this critical information because, for example, if an inmate began to experience complications due to COVID and then was transferred to a medical facility, although they are still technically incarcerated, if they are pronounced dead at the medical facility, that is no longer a reportable death. And this can also be seen in many cases where inmates are found unresponsive in their cells, but are not pronounced dead until they are taken to a medical facility. So given these restrictions and the ability for us to not 100% confirm all non-reports, there may be some critical information that we're missing, not only regarding the pandemic that we're facing today, but ultimately our overall reportable numbers. Oh, well, I meant to change the slide, but I didn't. Sorry about that. So I want to note that we can make the data collection tool that we came up with available to anybody that's interested if they think that would be helpful for their reporting agency. And just for time's sake, try to make this presentation as short and sweet as possible, and I would be more than happy to discuss any of the process or tool development in the later section. So with that, I'm going to give the ball back to Mark.
Thank you very much, Taylor. I'm going to now pass the ball over to Marjorie Stanek.
Hello, I'm Marjorie Stanek from the Kentucky Statistical Analysis Center, and I'm going to echo some of what Taylor said in her presentation about challenges that we face in Kentucky, but then to also talk through the specifics of what we're doing within our state to capture accurate deaths and custody reporting information. Our data collection strategy in Kentucky relies upon direct reports from a variety of agencies. And for many of these, there was some established process for reporting prior to the deaths and custody reporting re-implementation in October, last October. Those places include the Kentucky Department of Corrections, local jails, the Kentucky Department of Juvenile Justice, local coroners, and the Office of the State Medical Examiner. The CJSAC staff also conduct supplemental media searches to identify deaths that occur during law enforcement contact, but prior to being booked into a facility. And I will say that during the previous, up through 2014, the previous deaths in custody reporting, that the SAC was also responsible for those activities. And so for some of us, this isn't necessarily new, kind of revisiting this deaths in custody reporting. We use some administrative funding from Edward R. Byrne Justice Assistance Grant Program to fund our staff time for the data collection efforts and reporting, given that these are not eligible activities under our SJS award, as many of you are aware. We're also considering adding a special condition that's specific to this reporting to all of our grant awards moving forward so that we can ensure maximum compliance. It is true, however, that we have a variety of law enforcement related entities within Kentucky that would be required to provide us data but do not necessarily receive grant funds. So this will help, but it won't totally alleviate the issues that we may have getting that information. We access information that we need to make these reports from a variety of sources. These can include no-fee official copies of death certificates that we get from our Department of Vital Statistics. We do have access to the Kentucky Offender Management System under an agreement that we have with the Kentucky Department of Corrections. This is some of the information might be available there. We have a process in place now by which we receive all of the extraordinary occurrence reports and other supporting information from the Kentucky Department of Corrections. And so their facilities, at least, are covered by that process. We search media accounts and other public records, much like, what I think you're going to hear from other states. And then we also receive results of toxicology and other relevant information about these deaths from the Office of the State Medical Examiner or coroners, provided that they're able to identify that these are law enforcement related deaths. And then we can, of course, also follow up with any of the relevant law enforcement agencies if we need some more details around any of those incidents. Much like what you heard in the previous presentation, there are some caveats for our deaths in custody reporting in Kentucky. Probably one of the major ones, and I would imagine that many other states are in this same boat, are that there may be overdose-related deaths where law enforcement is on the scene, and it's sometimes difficult to discern whether or not that is something that we would want to be reporting. It's very kind of circumstance specific in those situations, and it's not always clear to us whether, for example, the person was being detained or might have been arrested, or whether law enforcement is providing backup for emergency medical services or something of the like. We also have more than 80 local jails in Kentucky, and we are able to get this information. They have an agreement with the Kentucky Department of Corrections because in our state, Class C and D offenders, felony offenders, are statutorily required to serve their time for many of their sentences in a local jail facility. And so due to that agreement that exists already between the Kentucky Department of Corrections and local facilities, they are required to report any death that occurs, so whether that's a state or a local inmate. As Taylor alluded, we also have issues in Kentucky where perhaps someone is found unresponsive in their cell or experiences a medical emergency while they're incarcerated or detained, and they may actually be pronounced deceased in a hospital or some sort of medical setting rather than in the correctional facility. That for us is a little bit unclear, and so we choose to report those deaths and treat them as if they're corrections-related deaths, regardless of where the actual death pronouncement occurs. We also have situations where folks may be discharged from a correctional setting onto perhaps home incarceration if they have some sort of long-standing illness where they're going to require supervision. So if somebody is in a coma, for example, and they were an inmate prior to that medical situation, given that we lack staff and perhaps funding, particularly at some of the local jails, sometimes an agreement is made that that person is essentially reflected as released from custody, and then they may end up deceased. And so those are a little bit harder to kind of keep a handle on. We also, like many states, lack a really robust mechanism right now to confirm our hard zeros. You know, we have more than 400 law enforcement agencies in Kentucky, 80 local jails, prison facilities, et cetera. And so it's just very labor-intensive and time-consuming to confirm each of those hard zeros for the quarterly reports. And as of right now, we don't have the staff available to do that. And then we also lack some information about natural deaths that might occur. So if someone is in the back of a cruiser, for example, and experiences a heart attack or an asthma attack or an overdose, that information may not always be reported to us by the local law enforcement. We likely would not find it in a media search. And so we expect that there is some lack of coverage of these kind of events. Although they're extremely rare, we expect there's not a good way at present to be able to get that information. And so we're working to improve that system as well. We have been thinking as well about some of the populations that we may not be covering, and trying to consider ways to adequately capture that information for our reporting. There are, for example, corrections-involved individuals in Kentucky that might be in a drug treatment facility that's operated by or on behalf of the Kentucky Department of Corrections. And so they may not be viewed as an inmate while they're in that status, and yet it appears as if those individuals should also be reported based on the information that we have from BJA. The same situation is true for corrections-involved individuals who might be on work release or some sort of similar assignment, like a day treatment center, for example. We have persons who are awaiting transport to another state or to a federal Department of Corrections facility. We had one during our first quarter of reporting where someone was a federal inmate who was being transported from one facility to another and was spending time in a local jail and expired while they were in that local jail setting. And so it's sometimes a little bit unclear as to whether we should report them since it occurred in the local Kentucky jail, or whether the federal system should pick that up since they're reporting separately on those incidents. We also have, as I alluded to earlier, some deaths in which law enforcement is on the scene, but they may not have specifically detained an individual, or they're unsure. You know, maybe they show up and the situation is kind of already in progress, maybe an overdose, for example. And so it's unclear whether an arrest would have occurred. You know, if they use naloxone, for example, and that person is not revived, it's not always easy to identify whether or not that person would be captured in this data reporting or not. We have some further steps. You know, I think we're making our best effort right now, but we can always improve, and so we're considering all of the ways that we can make this system better. We are continually exploring ways to capture data from those gray area populations. So the folks that are in day treatment, for example, or are on work release. We are continuing, like I think all of the other states, to continue to expand those partnerships with other stakeholders. And it may not be only our traditional corrections, Department of Corrections, local jailers, those kinds of situations that we need to get only those folks to the table. We need medical examiners and perhaps drug treatment, community-based treatment providers and folks of those, you know, kind of stakeholder groups that we may not necessarily be collaborating really well with already. We are, as I said, planning to implement a special funding condition that requires reporting on all of our grant awards moving forward. We are hoping to also establish a scalable process that will allow us to confirm those hard zeros. At present, we are a very small SAC and not particularly well-staffed for a project of this type, and so we're looking at ways to kind of enhance that capacity and be able to say we are sure that, you know, we've reached out to all 400 plus law enforcement agencies, and we're sure that this is an accurate universe of folks that we're talking about. We want also to explore data that's in our KY Ops naloxone portal. So our state's a little bit farther along in responses to opioid abuse, largely because we've had this problem for over 2 decades in Kentucky. And so one of the things that was pretty forward-thinking is within the law enforcement operational system that we call KY Ops, a naloxone portal was established, and so we're able to track doses of naloxone and kind of the outcome of those. It's not entirely foolproof because not all of the law enforcement agencies in Kentucky use the KY Ops platform, but it does give us at least a starting place to work from. And then we want always to continue to educate our local law enforcement agencies and our coroners about the need for reporting. In Kentucky, as in many states, many of these folks are elected officials, and so there's change that occurs and kind of attrition. And so we need to be really diligent about getting those individuals to the table and getting them on board so that they're aware of what the reporting requirements are and that we get them, you know, kind of up to speed. And I think that's kind of a thumbnail sketch of what we're doing in Kentucky. As I said, you know, we think we're doing a pretty good job, but we're always trying to get better. And as we're getting into this a little bit more fully, there are a lot of things that kind of pop up, you know, that are situation specific, for example, and then you think, oh, I didn't really necessarily think about capturing that information or from that source. And so we're learning as we go, I think, like a lot of you all.
Well, thank you, Margie.
You're most welcome.
That was excellent. And as you can see from this next slide, we will now hear from Lisa Schoaf.
Okay. Can I have the ball passed to? There we go. Thank you. Okay. I'm just going to tell you a little bit about our deaths in custody reporting in Ohio. And before we start, I want to give you a little bit of an overview of what we've been doing for the past 15 plus years with this program. Just like for a minute, I want to go over a few of these things because while some of you are familiar with this timeline, there are a few things that were Ohio specific that I wanted to mention. We began the DICRA program in 2003 in response to BJS's request for data collection, and at that time, obviously, it was limited to the arrest-related death program. And because we've been collecting so much data, around 2008, we started developing annual reports to describe the arrest-related deaths in the state. This was based on the old BJS data collection tool, which personally I thought was more informative than the current BJA tool because of the additional data elements that it collected. And really, we still collect more data elements than what BJA requires, but we only submit, obviously, the data that BJA requires. We keep the rest for ourselves for annual reporting. The program was suspended in 2014 after BJS noted variability amongst states in how they collected the data and what data they collected. But during this time, we continued to collect arrest-related death data using that old BJS tool. The thinking at the time was that at some point, data collection was going to resume, and we didn't want to be put in a position of having to identify old cases. In 2015, our governor created a collaborative on community police relations. It was in response to some growing unrest in our communities as a result of the police shooting of an unarmed Black youth, as well as a few similar incidents. So, you know, sounds kind of similar to what we're going through right now. As a result of that collaborative, OCJS, which is the SACs parent agency, was tasked with a couple of different things. One of them was developing a data dashboard on use of force incidents. So we were a little bit ahead of the FBI in terms of using incident-based reporting to capture use of force. We started working on that a little bit beforehand. Right now we have 128 agencies who are capturing that information, but we still have a long ways to go. In addition, we also created a dashboard and a website specific to arrest-related deaths. And then obviously in 2019, we were tasked with collecting more than just arrest-related deaths, but all deaths in custody. So that's kind of how the program has evolved in Ohio, at least. A little bit of background, again, of Ohio. We consist of 88 counties and over 11.5 million people, and there are 868 active law enforcement agencies across the state, and about as many jails as there are counties in Ohio. There are also 28 prisons. The important thing to note about Ohio is that we are considered a home rule state, which means that the state has little control over local governance. As a result, very little is centralized, which impacts us in a very significant way when it comes to data collection. For instance, there's no state coroner. There's no mandate requiring law enforcement deaths to be reported to any sort of state entity. And until recently, there was no mandate requiring local jails to report any critical incidents or deaths to a state entity. So basically, we were on our own when it came to identifying deaths that were occurring at the local level. And as you can imagine, that's kind of a daunting task when you expand it beyond arrest-related deaths, because arrest-related deaths was hard enough. So currently, I'm going to tell you a little bit about what we're doing in each of these areas and where we have some challenges that exist and where we've had a few successes. So like I said, there is no mandate for law enforcement agencies to submit their arrest-related deaths to us. So we go and back to the basics. We've had to come up with our own methods for identifying these deaths. Google alerts based on key terms, social media reports, news clipping services, and most recently, we anticipate being able to use the use of force data that's being collected in our NIBRS database, but this really hasn't borne out any fruit yet because we're still getting agencies signed up. So that really hasn't been a good source yet, but hopefully down the road, that will become another source of information. We could actually, as a side note, we have an SJS grant right now that's going to allow us to take a close look at our use of force data to better understand what's being captured and whether it's being captured correctly. So just as a side note there. So because we have to be so proactive in identifying our arrest-related deaths, we turn to our SAA, which is our parent agency, for support. So we're using the SAA's connections to get the word out. Because the potential threat to JAG is real, the SAA has taken much more of an interest in collecting our data, or the arrest-related death data and the DICRA data. Sorry about that. We have partnered with the SAA to get the word out about the mandate in a couple of different ways. We have a newsletter that we put out monthly. It goes to all of our grantees, and a significant number of our grantees are law enforcement. We have letters that we've sent out to 2 state law enforcement associations, the Ohio Chiefs of Police Association and the Buckeye State Sheriff's Association, letting them know of our mandate. We also put a letter out through our Collaborative on Community Police Relations website, which has several hundred agencies involved, so getting that word out through that source. And we also, I believe we put, if we haven't done this yet, we're doing so soon, we're putting a letter out through our NIBRS portal. Our next step is to reach out to the State Coroners Association, because we don't have a state coroner, but we have an association of coroners, and letting them know about our need for autopsy findings, like cause and manner of death. They are our primary source of information on cause and manner of death and some of the demographics. So we reached out to the association several years ago, but it's probably time to go back and do that again, because I'm sure people have changed over the years. So they are our primary source of information, but we will also reach out to law enforcement if we need additional information on a case that we can't seem to get the coroner to be responsive. But that is how we are collecting information on arrest-related deaths, and so we are relying more heavily on our SAA to be involved. And just as another side note, just yesterday I had a conversation with our executive director of our SAA about the possibility of doing what it sounds like Kentucky is already doing or considering, which is tying grant funding to reporting. So this is the first time he's ever expressed an interest in this, and given everything that's been going on in recent days and weeks, this may be a move that we take to encourage law enforcement to proactively report to us, because even though we have a form on our website, our arrest-related death website, nobody ever uses it. So here is hard to see probably, but a picture of a snapshot of our web page that describes deaths in custody and what we're looking for, and our dashboard that shows limited details about arrest-related deaths, where they've occurred across the state, and the manner of death for these incidents: natural, accident, suicide, homicide, and undetermined. So those are the things that we've done with our SAA to, again, make people aware of what our mandate is and what we're collecting it for, what we're collecting the data for, and why we're collecting it. Moving on to our new partnerships, now that we're tasked with collecting data for more than just law enforcement, we started forming a relationship with our Department of Rehabilitation and Corrections back in late summer. We started working with them. DRC is in charge of 28 state prisons. Also, they have the Bureau of Adult Detention, which oversees the jails, and the Bureau of Community Sanctions, which includes community-based correctional facilities. Of importance here is that jails are run by the sheriff, and they're not run by the state, and as such, there's limited oversight of them, and this was a huge concern given the large number of jails that we felt we were going to have to reach out to independently. When this collaboration began, our big concern was, are they going to give us first of all, are they collecting the information, and second of all, will they give us the information? It turns out that this was a much easier ask than I thought it would be. We worked through their legal department. They apparently decided that this information was publicly available, and so there's no MOU, there's no legal anything for this relationship to occur in which they give us data on a quarterly basis. So that was a huge hurdle that was much easier to overcome than I thought it was going to be. So for the prisons, DRC had already been collecting this information, so this was not really a big ask once they got confirmation from legal that the information could be sent to us. Same goes for the community-based correctional facilities. DRC, our Department of Rehab and Corrections, oversees them as well, and so they too had already been collecting critical incident information from the facilities. So it's just a matter of them filtering the data and giving us the data that we needed for BJA's requirements. So that was, again, a much easier ask than I ever anticipated. The jails was the big question. Like I said, until January 2020, the Bureau of Adult Detention did not collect information on incidents occurring at the jails. But in 2019, there were a few high-profile deaths in one of our jails, and shortly thereafter, the Bureau of Adult Detention, through DRC, they submitted language to include in our Ohio Administrative Code that required jails to submit all critical incidents to DRC, which was huge for us because we were truly fretting about how we were going to be able to reach out to the local jails. So starting in January, we got our first batch of jail death data. So, we're still sorting through it, trying to figure out, some of those iffy cases, but at least we're getting the information, which was much more than I thought we would ever have. So where are we now? We still struggle to obtain arrest-related death data from law enforcement because we have to proactively identify all these deaths and reach out to coroners for confirmation. Again, we have limited involvement of law enforcement unless we need information about that the coroner can't provide. And like I said, we are considering now the possibility of tying the need to report deaths and use of force in general, so which would obviously include many of the deaths. We would be mandating that as part of a JAG requirement. So that is something that's being considered, which was never being considered before. We are successfully collecting information from prisons, jails, and community-based correctional facilities, and we are collecting information on juvenile facilities, which I didn't get into here, but no issues there either. Like the others have said, we have no way of collecting the confirmatory no responses from our partners. That's just too big of an ask with almost 900 law enforcement agencies. So we haven't really thought about ways around that at this point. Maybe we will in the future once we get things pinned down here, but until that happens, that is not, to be honest, really a priority for us. We're going to just do the best we can, which is what we've been doing since 2003. And just to give you some perspective, from January to March of 2020, our last reporting period, we did have the following stats. We had 12 arrest-related deaths that we had identified proactively. We had 28 prison deaths, 12 jail deaths, 1 community correctional facility death, and no juvenile deaths. So it'll be really interesting to see with COVID how these numbers are going to change, particularly in the jails and the prisons. I think that's all I have for me, so I'm going to turn it back over to Mark.
Thank you very much, Lisa. Excellent presentation. We will now hear from Jim McDonough from Virginia.
Hello, everybody. Thank you for being here. I'm going to run through how we develop the process in Virginia, and some of it mirrors what you've heard about how things went or are going in the other 3 states, and some of it we do a little bit differently. And as you'll see, we also are still working through some of the caveats and challenges with this reporting that other states have. Just a little background, the SAC in Virginia is located in the Virginia Department of Criminal Justice Services, which is the SAA for Virginia. So we're fortunate in that we're located within the organization that is responsible for this reporting, and we're able to work closely with the SAA folks in terms of the mechanics of getting the data reported to BJA. As with Ohio, Virginia SAC was involved with the first round of the arrest-related deaths reporting requirement from the feds that began in 2003. Like Ohio, we collected data through 2014 when the program was then suspended by BJS. Unlike Ohio, we did not continue collecting the data afterwards. We came back into this process when the new current Deaths in Custody Reporting Act came to us. So we had a lot of experience dealing with it from the law enforcement reporting side, but not from the correction side. That was a very new thing to us. So what we did to begin with is we identified the potential reporting agencies in the state of Virginia, and we identified nearly 500 agencies that could potentially report death. We had law enforcement agencies, 240 police departments, 122 sheriff's offices, jails. We had 36 local jails and 22 regional jails. Again, similar to Ohio, our jails are operated by the sheriffs who are elected in each jurisdiction, and the state has only a limited amount of control over what they do. So bringing them on was one of the issues we had to deal with. And then what we also had, which was new from the last time, was the correctional agencies. And as you can see in this slide, there are major institutions, field units, work centers, hospital units, 1 private prison on the adult side, And then on the juvenile side, the Virginia Department of Juvenile Justice operates 24 juvenile detention centers, 1 state-level juvenile detention center, and then a variety of different types of local non-secure residential placement facilities. So again, the biggest challenge we saw was how are we going to identify and then maintain contact with these almost 500 agencies. That was one of our, our big fears, if you will, going into this thing. So what we did is, building on our experience when we were doing the arrest-related deaths with law enforcement, the SAA convened a meeting of the representatives of these potential reporting agencies throughout Virginia. Virginia Association of Chiefs of Police, Virginia Sheriff's Association. We worked with those 2 organizations when we did the outreach to the law enforcement agencies for the first arrest-related deaths reporting. Those agencies work fairly closely with the SAA because the SAA provides a lot of grant money, a lot of training, support, technical assistance, things like that. So we've always found that it's a lot more credible when you're able to bring on these associations of these various agencies and have those associations representatives go out and sort of sell the idea of cooperating in this rather than having it just drop out of the sky from the SAC. And then we also brought in state police and the various agencies and associations for corrections. Also, building on the experience we had from the last time, we brought in the Office of the Chief Medical Examiner because that was our main source of information. We were collecting just the arrest-related law enforcement deaths some years ago. So one of the first things we did is we addressed what are the concerns these various agencies had. And as you can see, some of the things that they identified as issues they saw going into this was just the staff time required to collect and report this data. Again, it was, it was seen as a lot of these things are often seen as an unfunded mandate. Do this, but we really don't have any resources to provide you to do it with. There were concerns about duplicating existing reporting requirements. At the time this was being put together, the BJS still had in place its data collection system for both law enforcement and corrections deaths. So those were being reported already. And my understanding is that the way the law is structured now, that reporting to BJS ceased when this reporting took its place. There were also some concerns that, for example, law enforcement reports use of force data to FBI, and the whole thing was simply that, are we going to end up reporting some of this stuff multiple times? The other thing that was a large concern was release of personal identifying information. That's, I think, much more of an issue than it was back in the original arrest-related deaths reporting. Another issue that they had concerns about, which again was an issue with the last round of this, was a lack of a clear definition of what constitutes a reportable death. And as folks from the other 3 states have all mentioned, that that continues to be an ongoing issue with us. You have deaths that occur in hospitals after someone is transported from a correctional facility. You have these law enforcement situations where it's a little bit nebulous whether they're considered in custody. Situations where, for example, it's a barricade situation and law enforcement has surrounded a house. The person that's barricaded in the house shoots himself or herself. There are various gray areas like that. One of the issues we occasionally ran into the first time with this is who reports the death when multiple agencies are involved. Sometimes you have situations where multiple law enforcement agencies will respond to a scene. And at least initially, it's sometimes a little unclear which agencies were most, if you will, involved with however the death occurred. And then they were concerned about reporting of individual agencies by name, basically bad press. So those were the concerns that we basically had to work through with these potential reporting agencies. And then the SAA itself, which is responsible for doing the data collection, we had some concerns. Some of those mirrored what the individual reporting agencies had. Other concerns we had were how you keep up with 500 potential reporting agencies, given that there's often a lot of turnover among the people in these agencies who become the contacts for receiving this information, and getting them up to speed on how to do it if they're coming in new. The other issue that was a big concern to us, as has been previously mentioned, is this question of how you obtain the affirmative no responses. The way we saw it is there's going to be a fairly limited number of organizations that are going to actually have deaths to report, and that's some defined number. But then there's probably this much larger number of agencies, particularly when you talk about smaller ones, law enforcement agencies. Well, they're not going to have any. So how much work are we going to do to go back and track down all those that don't have any, which would probably be a much larger number than those that do? So the strategy we came up with, and again, this kind of builds on the strategy we developed the first time, is we're fortunate in Virginia in that the Code of Virginia requires pretty explicitly, as you can see here in the language, that upon the death of any person in a jail, a prison, other correctional institution, or in police custody, that agency is required by law to notify the Office of Chief Medical Examiner, and then the Chief Medical Examiner will have an investigation done on the cause and the manner of that death. And that's what we used when we were doing the original deaths in custody reporting as our primary data source. So what we did is we, again, worked out an agreement between the SAC and the Office of the Chief Medical Examiner. In this case, we had a more formal process, and a lot of that, I think, was driven by the fact that there is a lot more concern now about releasing and sharing personal identifying information there was when we did the original arrest-related deaths. So our staff and the staff of the OCME sat down and we put together a memorandum of understanding that would spell out how the data sharing process would work. And essentially it said that we'll use a secure transmission process. We will use this data only for reporting to BJS. We will maintain the data in the SAC securely only as long as we need it, and then we'll destroy it, and that we would limit access to the data to 2 SAC staff who would be reviewing the data, and then 1 person in the SAA's grants management section who enters the data into the performance management tool that BJA is directing us to use for this reporting. So it took a while to work out all the mechanics of this, but we got it done. And prior to having to start reporting the real data, what we did is we tested the process. We tested the process whereby the Office of the Chief Medical Examiner would look at their electronic file. They would extract just the data that we outlined as needing for our reporting to BJA, put that in a file, and send it to us. where we can then review the file, basically determine that it looks like what we need is there, it looks like a reportable case, and then the SAC packages that up electronically and sends it to our grants management staff, who in turn sends it to BJA. We tested that using a quarter of data before the required quarters of data were reported, and we found that basically it worked. We ran into some caveats and things like that too, but we showed that the basic process worked. And we did our first formal reporting in April of 2020 for the 3-month period, October through December of 2019. That first file we received and we passed on to BJA contained 32 reportable deaths. Only one of those was arrest-related, law enforcement-related. The remainder were correctional custody deaths. And based on our looking at how these types of deaths fall out in Virginia, we were expecting that we would have way more correctional deaths than law enforcement deaths. And we still have some outstanding issues, and some of these are issues you heard described by the 3 other states. We still have this issue of, are we getting through the OCME all of the reportable deaths under the DICRA law? Our sense, based on how this worked the last time, is that we're getting most of them, but we still think there are some that are falling through the cracks. When we did this last time, we also did some searching of social media, of newspaper reports. We looked at the NIBRS reports that we got, and we sometimes found cases that were not included in the OCME reports. We'd have to go back and track those down. So we're expecting there will be a need for that as well. One thing that the OCME report does not capture, that's a field required for BJA, is the date that the deceased person was admitted to a correctional facility. We're not sure yet how we're going to do that. We don't want to have to go back and contact every one of these agencies for the sake of collecting one single field of information. So we're still trying to figure out how we're going to deal with that one. And then the affirmative no's, in talking with the SAA, what the SAA, not the SAC per se, but the SAA, their legal folks looked at this question and gave us a legal interpretation that says, if the Code of Virginia requires that all these deaths be reported to the Office of the Chief Medical Examiner, then no report is, again, legally interpreted as an affirmative no, given that they're required to do it. That's not a research approach, but it's a legalistic approach. So we're still going to be working with that. And our take on it is that we'll do this reporting for a while and we'll find out what's working and what's not working, and just sort of have to correct and improve along the way as we see how this goes. As some of the other states have said, we don't have staff that are dedicated to this. We have part of a person doing it, and it's clearly bigger than what we have resources to throw at it now. But we're we're doing what we can with what we have, and we will work to improve it as we can. But that's where we are now. We think we're pretty well along the way. We're not totally there. And with that, I will end my presentation.
Well, thank you, Jim. You covered a lot of ground with that report. I want to thank all the presenters. I see that we have a little time for questions. I've been tracking the chats that we've received so far, and most of you have actually seen them. They're not really questions, but more comments about some of the common themes that have been covered by the presenters. And I would have to say that most of the comments have to do with what's been purported as a confusing issue regarding the deaths that are pronounced at a hospital after an incident takes place at a law enforcement agency. And it seems as though there was some conflicting information that might have come at different points in time from BJA. I think we should probably pay attention to the comment where, and this came from Jim Saul, that in dealing directly with the BJA principals in their Office of General Counsel, the consensus seems to be that these deaths are reportable. And I guess, according to Lisa Sampson, there was different types of information that was being disseminated at different points in time. The first version of the frequently asked questions said not to report deaths of inmates transferred to hospitals, but the later FAQs said to report those cases. So that seems to be the consensus. So I don't see any other questions, but as we continue here, I'll just wait a little bit to hear if there's more questions. I'm opening up a poll to get your reactions today to today's program, and it's very important that you please take a minute to provide feedback to us before signing off. Your input really helps us fulfill our reporting requirement. So I'm going to just wait a minute and see if there's any other questions that come up. Okay, it looks like there are no questions. You have the information to contact some of the individuals, of course, that participated in this webinar, and the webinar itself will be posted on the JRSA website shortly, so you can certainly follow up with JRSA on any of the specifics as well. So again, please take the time to provide your feedback, and then you may sign off. And thank you very much for your attendance.